Hello friends, welcome back to IEN Facts Canada. My name is Anne, a registered nurse here in Canada. If it's your first time here, please feel much welcome and thank you so much for tuning in. You are in the right space. Today's video is all about registration or licensure process for internationally educated nurses in the province of Ontario. So if you've been looking forward to register with the College of Nurses of Ontario, then watch till the end because I'll be sharing all the details and all the information that you need to know before you start your application with the College of Nurses of Ontario. So let's dive in. The College of Nurses of Ontario is the regulatory body for registered nurses, registered practical nurses, as well as nurse practitioners in the province of Ontario. So for every nurse who in that classification who wants to practice in the province of Ontario must first become a member of the College of Nurses of Ontario. And just like any other province in Canada, Ontario has its own requirements for you to meet to be able to practice in the province of Ontario. There are 4 major requirements for you to meet, okay? And number 1 is your nursing education. You must be able to demonstrate that you have successfully completed a nursing education program for the nursing classification that you want to apply for or that you want to be registered for in the province of Ontario. So if you're a registered nurse, you must have completed a nursing education that is designed to prepare you to be a registered nurse, or if you are a registered practical nurse, the same, or if you're a nurse practitioner, the same. Okay, so you must be able to demonstrate that you are capable to practice in that nursing class that you want to be registered for. All right, so for those who have medical degree, or they are midwives or health technicians or any other health professional, and they have not undergone through any nursing education, then their application will not be considered by CNO. So please note that, okay? Because I know that is one of the questions that will be coming in the comment section. So please note that. Number 2, we have the evidence of practice. And this refers to any information that shows that you have the practice or you have the experience in that nursing class that you are registering for. Okay, and there are different ways for you to be able to demonstrate if you have been practicing or if you have enough experience for the past 3 years. Okay, number 1, if you have completed your nursing education within the past 3 years, that is considered as an evidence of practice. Okay, if you have been actively practicing in your home country for the past 3 years, then you meet this requirement. If you have additional nursing education within the past 3 years, such as a post-basic bachelor's program, then you meet this requirement. And one more thing is that you must be in good standing with your nursing regulator in your home country. So you must be actively registered by your regulatory body in your home country for you to qualify for this application. Okay, so either of those that I have mentioned, if you meet either of those, then you meet this requirement. Okay, number 3, we have your language proficiency, and that is either English or French. Okay, and also there are different ways for you to demonstrate that you have the language skills that is required by CNO for you to be able to meet this requirement without necessarily sitting for an exam such as IELTS or any other language proficiency exam. And number one, if you have completed a nursing education program within the last 2 years and it was conducted in English, then you meet this requirement. Okay, if you have had any other additional courses or nursing programs that were carried out in English, then you meet this requirement. If you have been practicing in a setting that is English oriented, then you also meet this requirement. Okay, and that is within the past 2 years. Okay, the other option is that if you have done any exam and you have been successful, then you also meet this requirement. You just need to provide the proof that you have been able to do so, maybe by submitting your test results. Okay, so those are some of the ways that you can be able to demonstrate that you meet the language requirement. All right, the other requirement is the registration exam, and that's the requirement number 4. So for you to be registered by the College of Nurses of Ontario, you must be able to pass your registration exam, and of course that is NCLEX. Okay, so you must be able to successfully pass your NCLEX exam. Okay, for those of you who have maybe done NCLEX for maybe other provinces or any other country, then you qualify for this registration. All right, so those are the 4 major requirements. Okay, and of course the registration exam comes after you've been able to meet the first 3 requirements. All right, so because they must be able to assess whether you meet all those other requirements before they can be able to give you your ATT or authorization to test for NCLEX. They must first be able to assess that you meet those other requirements. All right, but if you have done your NCLEX already, you are considered like you have met all those other requirements. Once you're confident that you have all these requirements, then you can begin your application. With Ontario, you must first apply to the to NNES. Okay, so you must first apply to NNES, get your advisory report, and then create an account with CNO. And with NNES, they are going to evaluate your nursing education. They are going to evaluate your language proficiency. They are going to evaluate your nursing practice or your nursing experience. And then they are going to compile all that into one report, and then they are going to send it to CNO, and then CNO is going to evaluate that report. Okay, and that's where decisions are going to be made. So if your advisory report states that you have comparable education or nursing practice equivalent to Canada, so comparable means it's equivalent to Canada, then CNO is going to give you ATT so that you can prepare for your NCLEX or you can register for your NCLEX. Okay, and for those who are going to get the advisory report that states somewhat comparable or not comparable, CNO is also going to go ahead and review that report and identify the gaps that you are missing. Okay, and once the gaps are identified, they might recommend that you do additional courses, or they might recommend you do an assessment, a practice or a competency assessment. And depending on how you are going to perform, then they can be able to be convinced that you have the competency, or you have what it takes to practice safely in the province of Ontario. So they are going to issue you with your ATT, and then you can register for your NCLEX. All right, if you're not successful when it comes to your competency assessment or your additional courses, then they might recommend that you do a nursing program so that you can be able to cover all those gaps. Right? So if you meet all the requirements and you certify that you are capable of practicing safely, then they are going to issue you with your practice license. All right, and their processing time is quite different, and I always say it varies from one application to the other, because people have unique situations from submitting their documents, from meeting some other requirements. So it varies with how much time is taken to evaluate your application or before you get your practice license. And according to the CNO website, every submission or every requirement that you meet, that will take about 15 days to be able to incorporate, to review that, and be able to give you a feedback. So if you are able to complete or to submit all your requirements in one day or in one sitting, then within 15 days you are able to know which other step to take. Right? So it varies from applicant to applicant. Basically, that's all it takes for you to be registered with the College of Nurses of Ontario. And of course, once you are done with your NCLEX, then you're going to do your jurisprudence, and also you're going to submit your criminal record. You know, those other minor requirements are going to come hand in hand, and then you can be able to practice in Ontario. I think that's all for this video. If you have any question, kindly leave it in the comment section, and I'll try to answer to best of my knowledge. And until next time, it's a bye-bye.